Morphine is a tightly controlled drug that is derived from opium. It remains the first line of treatment for acute pain for life-threatening illnesses like cancer, heart and kidney diseases, among others. The drug is manufactured at Hospice Africa in Kampala with adequate supplies to the national medical stores before they are distributed to the various health facilities.
We supply NMS at least 5,000 to 6,000 bottles of the morphine product every 3 months, and they share that out with the joint medical stores. So
according to Chris Intege, a pharmacist at Hospice Africa, the challenges in the chain of production are inevitable.
A bit tedious because it's a narcotic. We have to go through the National Drug Authority to get a permit to be able to import the morphine powder. So the morphine powder is imported from Europe, and the process of importing that powder usually takes many weeks, about 20 weeks to get the powder in, because it's a narcotic and the control that is around the narcotics. But when the powder comes in, we usually buy a quantity that takes us for about a year. So we buy once a year, and then we keep the powder here at Hospice. And
Dr. Jacinto Amandwa is a former Commissioner of Clinical Services at the Ministry of Health, who argues that production of morphine may remain as long as patients and medics distance themselves from the drug.
People fear morphine, and even among ourselves, people fear to prescribe. There are a lot of misconceptions about morphine among the health workers, the public.
According to Palliative Care Association of Uganda, an estimated 3.4 million Ugandans who require palliative care services cannot access it, while many continue to die in severe pain. In the year 2010, 80% of the 16,526 patients who died of cancer in Uganda had moderate to severe pain, and about 50% of people who died due to HIV-related causes had moderate to severe pain. Experts have, however, expressed concern with the 2016 Narcotic and Psychotropic Substances Control legislation, which only allows medical practitioners, not nurses and clinical officers, to prescribe narcotic medicines.
People fear morphine, and even among ourselves, people fear to prescribe. There are a lot of misconceptions about morphine among the health workers, the public.
At least 203 health facilities in Uganda provide some form of palliative care, with morphine being availed free of charge. Zahra Namuli, NBS, Live at 9.